We're so blessed and excited to be able to help so many patients where we really believe and know that we're doing something different than every other stem cell company in America. And no one does it like we do in the sense that we are sending our medical professionals out to you where you can get stem cells in your home. And one of the biggest objections and questions we got this week, which I think we're going to address, Dr. Scott, is why are our stem cells less expensive than other people claiming they can come into the house? And Dr. Scott's going to share why that is. The other really big questions that have come in are, does stem cells help with chronic pain? That's obviously one of them, big ones. But we've had a lot of people talk about their blood sugar being out of control, whether it's diabetes, and then we've also had a lot of questions about autoimmune. So we're going to put Dr. Scott on we figured the best way to do this is just jump in here with you and answer your questions and support you. And I'll try and be the tour guide for Dr. Scott to make sure we get everything answered for you. So, Dr. Scott, I'll let you lead off and kick off. What I think is always important for people that are new to Konnect Relief is, do you mind just giving the quick backstory of how you have evolved into one of the leaders of stem cells throughout the country and how we stumbled across, or how you stumbled across, actually the breakthrough idea of sending medical professionals direct to patients? And yeah, let's just start there. I think people would want to get to know you a little better.
Yeah, definitely. I've never had any idea that we would get to where we are with Konnect Relief and what we're able to do. But when I first started in stem cell and I was studying under Dr. John Young, medical doctor down in Florida, where I am now, I started learning about stem cell, got really excited about it. And so I opened a medical clinic in Ohio, and we started treating a lot of patients with stem cell, educating folks, and it was super exciting. Loved all the results and everything. So I'm a chiropractor by trade, and I literally fell so much in love with stem cell that I started building medical practices to do this, just because it was doing things that I'd never seen before and was just loving how we could help patients that really couldn't get help anywhere else. And I actually sold my chiropractic practice, went totally into this, eventually moved to Florida. I opened 7 offices down here in Florida. And so we started treating hundreds and hundreds of patients. And then basically I started getting to think to myself, how could I help more people across the country? How could we get out there and help others? And I started talking to some other folks about, how do we do this? How do we bring this to the masses? And really what actually clicked in my head is, when someone does insurance with me and they come to my house and they sit down with me at the kitchen table, they gather all the information that they need to be able to get the answer. Then they take it to the underwriters to really get the final answer on what needs to be done. And so we said, what if we did that? What if we could educate people? And then if they want us to come around and meet with them, we'll do that. And then what'll happen at that point is we'll send everything back to our medical team. And so I started building medical teams in multiple states. And so we've built this giant network of medical doctors and nurse practitioners all across the country. And so we're the first ones to ever do in-home stem cell treatments. You may see other people that are doing it right now. We were the first. We invented the model, so to speak. And one of the reasons that it's cheaper for us to do it is because we do have the biggest network of nurse practitioners and medical professionals across the country that do this. Actually, many of those groups stemmed off of us. They saw what we did. Some of those guys were part of my company, and they split off to try to do it themselves. The grass is greener, and that's cool. I'm excited that those folks are getting stem cells as well, but they always come back to us and say, hey, can we tap into your network? Can you help us out? Because they know that we've got the medical teams and the medical professionals that have done the most treatments and are in the most places. And because of that, it keeps our costs down. And because we order so many stem cells, we get the best deal on stem cells. So we get the best pricing, we've got the biggest network. And that's really why a lot of people will see our price and say, you're so much cheaper. We're able to do that. And one of the biggest things that always bugged me is just, it's not a cheap thing to do, but it's the best investment you can make in your health. But my goal was to try to bring that price down for people. We continually try to do that and figure out ways to do that. And that's why we've been able to create the economic model with our system and what we do. So that's how we got here. Never thought that I would have the biggest national group delivering regenerative medicine, but that's where we are. And that's why we're here. And we want to get the message out to people that you can have this at your home and the comfort of your own home. You don't have to travel outside of the country to get these things done.
Yeah, that's fantastic. We have people coming into the attendee list and questions are coming in. So if you're here, you can ask privately, by the way. I'm going to ask on your behalf, so please don't be bashful or shy. Get your question answered while you're here. And then I want to speak to the one thing that you said that I think is very important is that because of us being uniquely positioned, we get to do things for our patients that allows us to keep the pricing within that range. And pricing is going to vary based on like where your current position's at and situation's at. And so that's why we always say get on a call with one of our team members who can help facilitate a recommended action plan that makes sense for where you're at. And you're not going to get on the call with Dr. Scott directly, but our team have access to Dr. Scott and we'll get the questions or the answers to you if they can't answer it for you. So please do that. Dr. Scott, I'm going to jump in with a couple of the questions that came in just because they're here first and they're asking, right? I heard, okay, so I'm going to give you the two-part question, and then it's from our friend, our new friend that came in here. I heard there can be swelling or pain at injection sites around the areas like the knees. Can you speak to that? And I'll just give the second question since she asked it. What does aftercare look like?
Yeah, definitely. Yeah, so when you think about a stem cell injection, especially in a joint, it's exactly like any other injection you would get in a joint. So if you've had a cortisone shot, if you've had any of the Synvisc, Orthovisc, any of those types of treatments, those are the types of things that can happen from those type of injections. So your normal swelling, redness, those types of things can definitely happen. And that's really the biggest issues that we see with folks. There's really not any other issues that come from that. Now, obviously, our teams are we've got the best nurse practitioners. They've done hundreds, if not thousands, of treatments, the ones that we have, because we've done so many. And they know how to make sure it's a clean environment. They do it right. They do it in a way that you have the lowest risk of infection. And I'll tell you, to be honest with you, and you guys may know this, that you're more likely to get an infection if you go in a hospital environment
Yeah.
than anywhere else. Doing
Yeah.
it in the comfort of your own home where it's all the stuff that your body is used to, and you've got a nurse taking those precautions. Yeah, you may get redness or swelling and those types of things, but those things go away quickly. And our team is there to help you. And speaking of after treatment, what happens? Our team is actually going to contact you within 24 hours to make sure you're doing good. If you have any of those issues, they're going to talk you through what you need to do. We actually give you a lot of information ahead of time. We give you a full booklet on exactly what to expect, exactly how it's going to go, so that you know what to do. But our team is there. Our nurse practitioners, our medical team is there to answer your questions if you have them. So they're going to reach out to you. And then we have a scheduled follow-up to where they're going to reach out 30 days later, a few months later, to make sure that you're making the progress that you want. Because stem cells is one of those things that it's not a quick fix, right? This is something that how stem cells work is the stem cells, we put the tissue in the body, and those mesenchymal stem cells have a lot of things in them, growth factors, exosomes, cytokines. And that's why I've gotten away from saying stem cell therapy. There's so many things in this tissue that are helping your body heal. But what happens is it's something called paracrine signaling. And when those cells go in, they don't become part of you. You don't get people's DNA or anything like that. The cells go in and they start shooting out growth factors and exosomes and cytokines and all these things to get rid of inflammation and kind of flip the light switch back on in your body to start healing again. And so once the cells go in and then eventually they're gone, your body gets rid of them like any other thing that we put in our body, like a cortisone shot or the Synvisc and those types of things. Your body has now been turned on and your body continues to heal. That's why people will say, it took a month, but then all of a sudden my pain was gone. It took
Yeah.
me, it was crazy. 5 months later, all of a sudden my pain was gone. And that's how this tissue works. That's how stem cells, exosomes, and all those things actually make that long lasting change in your body and keep your body healing even after they're gone. But we are continually following up, making sure that you're making the progress that you want.
Can I follow with two quick things on that? And I have a question there on that as well. So what's so amazing that you just brought up was that I didn't know this when I joined Konnect Relief, everybody. And by the way, everyone you speak to at Konnect Relief are also patients of Konnect Relief. So we have received stem cells. It is the most non-invasive experience I've ever had. I thought I'd be on an IV for 2 hours and it'd be a big ordeal. And it was very easy, very efficient. Everything was pain-free. There was none of those issues or concerns. What I learned though was that the reason, because everyone asks, why do stem cells work? Like, why does this process work? And then I did the research you sent over to me was that when you're little, you have millions and millions of stem cells in your body. And that's why like young kids can bounce back from injury and rejuvenate. Like I have 7 kids, right? And so if one of them scrapes their knee when they're little, like by 5, it's healed. Hypothetically, right? Jokingly wise, but it's true. And as you get older, you get less and less. By 50, it's diminished dramatically. And then by 80, it's diminished dramatically, correct?
Yeah.
So then what I learned was when going through this process with you, that when we receive the stem cells, they actually, by turning on the growth factors, they actually they multiply and compound. Is that within 60 days or something like that? Can you speak to that a little bit?
Yeah, a lot of people used to say that when the stem cells go in, they start replicating and multiplying and everything. And that was the belief a long time ago. Some people still fight that and say that they do that or they don't do that. But really, what we're finding is it's what it's doing in your body that it's turning your body back on. That's why
Your
you get the
own
lasting.
natural, yeah, that's so great. So your
You're cutting up there a little bit, Ed.
oh, it- as in
So Ed's his internet connection is a little shaky there. So what I'm going to do is jump in. So some of these questions are coming in about ALS, Parkinson's, and let me just address those issues like the autoimmune, the neurological, and those types of things. So, one of the things that is very important to understand about what we do with regenerative medicine in the US, and what that is that in the US, luckily, we have the right to try whatever we want to help heal our problems, right? And so there are studies out there that show that stem cell help with different autoimmune diseases. And like my daughter has type 1 diabetes. I'm using them with her because I want to reverse diabetes in her. And there's been studies that have shown that. So that's my mission in life. So that's how I'm using it. But can I go out and say, hey, are you type 1 diabetic? I can help turn that around. I can't say that in the US. I can't say that I'm going to treat an autoimmune disease, that I can fix this or fix that. What you have to do is look at the research, and you'll find lots of research on these things and how they work. And if you want to try this treatment with stem cells and cytokines and all this to treat those things, we definitely can do that for you. Now, are we fixing it, treating it, curing it? No, we can't talk about that kind of stuff. But if you want to try stem cell for it, you can do that. We just have to have you sign a consent form that says that there are other options. There's medical options. There's for your joint pain. You can do cortisone. You can do Synvisc and Orthovisc and all those things. And we put all that out there. You can do physical therapy. But if you want to try stem cell, you say, hey, I want to try this thing. I've done my research. I've heard that it works and I want to do it. I use it for specific things myself, for my daughter, and a lot of our patients use it for things that they've researched and want to use it for. So that's up to you. We just can't talk about it's just like vitamins. Like we know that vitamins are good for us and that they can help our biological processes, but a vitamin company can't make any claims about what those vitamins do. So it's the same thing. We can't really claim that we can do anything, and we don't, but people do have the right to try whatever they want.
Yeah. Can I ask you a question? So what, and yeah, everybody, just so you know, like I'm in Chicago and for some weird reason, Xfinity's just giving me a little hard time. So thanks for your patience on that. What is the mechanism of action? Like what is actually happening in the body that why people that may have some of those, like whether it's blood sugar issues, healing issues, that's drawing them towards stem cells? Can you speak to that more from a what's going on the tissue level and on the cellular level?
Yeah, absolutely. Like you think about autoimmune. What's happening for my daughter? Her pancreas, for some reason, has decided to start attacking itself. So her
Hmm.
pancreas is something flipped in the genes and whatnot that had that start attacking those islets of Langerhans, so they're not putting out insulin like they're supposed to. So she's on insulin now. Now, what stem cells are doing is, again, when they go in, they're turning those mechanisms back on. It's just biology. Stem cells are healing. They're always healing. And for some reason, sometimes our body doesn't have enough there or have the right ones that are there to be able to help fix those problems. So I always talk about it like if you want to build a house, but you can't get the lumber or the steel or the supplies to do it, you're never going to be able to do it. So if you can get the supplies there so the contractor has what they need to build the house and make it happen, then those things can happen. And I'm not even saying that I don't know if this is going to reverse my daughter's diabetes, but I'm giving it a shot because I know it's the best thing out there. And I know in Japan, Belize, China, there are studies of them reversing it. So I'm going to do everything I can to do that. But just think of it this way, it's biology. These are day zero cells
Yeah.
that come from the umbilical cord. And again, you're not getting their DNA or anything like that. They don't have what's called human leukocyte antigen, HLA. Therefore, it doesn't get rejected. When people do organ
Oh,
transplants and things like that, where they can actually be kicked out or rejected, the mesenchymal stem cells specifically don't put that HLA antigen out to cause that rejection. And so that's why it's worked so well for so many people for different things, because those cells can just go in and do what God designed them to do. I always say it's the power that made the body is the power that heals the body. And that's really what I can say about stem cells and the things that I've seen. Sometimes we can't even explain it. We can't even explain why it happened. I had one patient that came in for a back pain problem. He got some injections in his lower back and he did an IV and his back pain went away. But what he wasn't even trying to deal with was he had eczema, right? He had all these skin disorders to where his skin would get real scaly, his hands would bleed, and that just went away. And we weren't trying to do anything. It's literally letting the body take this and do what it does to heal. It's literally just giving your body these tools that can heal in ways that we've not figured out in Western medicine yet.
yeah, that's so amazing. That's so amazing. What I was going to say earlier is when we were talking about the firing up the growth hormones and firing up the healing side of it, I was going to say that when people ask, what's the expense or what's my investment? One of the things I do like to say is that when we've been trained our whole life, when you go buy a car or you go buy other things, they devalue immediately when you drive off the parking lot. So people are willing to spend 35, 40,000, get a loan for something that immediately is devalued, where something like stem cells, it increases in value with time. It doesn't decrease in value with time, especially if it affects your health. That's a no-brainer there. Okay, what are your stem cells the best compared to others? I don't know if I'm saying that question accurately. What are your stem cells the best compared to?
Why are the stem cells best?
Oh, okay.
So I'll tell you. So we actually worked on working with labs to get literally the best stem cells out there. Because we do so much, I went out and tested every single stem cell in labs and figured out what had the most mesenchymal stem cells in them and everything. And I'll tell you, most people that are out there doing this now actually use our stem cells. So we've contracted with high level labs that are FDA approved labs. They have to go through all the quarantining and all the things that the FDA oversees them for with the ISO 7 clean rooms, ISO 5, all these different things, so that we know that we're getting the best product out there on the market. A lot of people would put in 150 grams of tissue, and we doubled it to 300 grams of tissue so that we knew that we would have more than the closest competitor. And again, most of our competitors out there actually use our product now that we have contracted to get.
Which is another reason why if you're trying to buy from a competitor that has a higher price point, there's a reason why that, because we have cut out the middleman. There's no middleman when you come direct with Konnect Relief. I have two questions. One person asked, I have shoulder injuries, I have knee injuries, and I may need more than just one injection. Is that possible? And how does that kind of work?
Yeah, absolutely. We basically go through everywhere that you're having issues, and we talk about our team will go through what the medical team typically does for those issues. And if we have people that get both knees, both shoulders done, we have people that get two knees and their back done. We have some people that get you can change it up however you want. So yes, you can get multiple treatments. And we pass that savings on to you because with the in-home treatment, a lot of that cost is getting our nurse practitioner out to you, getting them to travel to you, paying them. And if they can knock out a few things at one time, you'll get those. If you do them all together, it'll be cheaper to do them all at once. And so we're able to pass that savings on. But yeah, you can get as much done as you need to when you're there, and we encourage you to do it just for the cost savings for you on that.
Yeah, that's fantastic. Okay, two more questions, Dr. Scott, unless I see any more come in. I think we'll be good for today. But one question came in with, oh, we have more coming in right now. You always say that, hey, we're wrapping this up, and boom, all the questions come flying in. Lymphedema. So how would stem cells positively affect lymphedema?
So think about it this way, with most issues in our body, they're stemming from some type of process that's gone wrong, right? So whether it's inflammation somewhere, whether it's something in one of your organs, pancreas, liver, and whatnot. So we want to go back to what's the cause of that issue. And the thing with stem cell, when you do a stem cell treatment, when we put them in the body, your body is taking them and using them where it needs them. So think of this. If you cut your hand, what's going to happen is your body is automatically going to send white blood cells there to fight infection. It's going to send platelets there. It's got to clot the blood. We've got to get, collagen and fibrin there to close the skin back up. You don't have to think about any of that. And so what happens is in your body, when we put stem cell in, it's your body's going to take those and it's going to move them immediately to where it needs them. So that's the thing about stem cells, that like we can't tell the cells where to go. Now, if you have joint problems, yeah, we're going to put it right in the joint so that we know your body can use it right there in that capsule and let it do its thing. But people that have more systemic things going on, we're able to give you the stem cell and we let your body do the healing. No doctor in the world has figured out a better way than what these cells know to do, because again, it's just biology. It's the way God designed our body, and we let it do the healing because the body's smarter than we are.
The body's smarter than we are. That's so good. Claretta, I'm gonna answer that question in a moment. That's a great question. Can you get them in the chest area near the sternum? I was gonna ask, is there a follow-up or more specific question with that? But we'll start with there.
Yeah, and it just depends on tissue and that around the area. The medical team makes that determination when they meet with you. Typically, we're not doing much in the sternum, obviously. So when we do this, we're not going deep. The medical team is not going to go deep, like where they're going to get close to your nerves in your spine or anything like that. Typically, it's intramuscular. And again, why does that happen? Or why do we do it that way? It's just like when I first got stem cell. I was a chiropractor by trade before I got into all of this and built all the medical teams. And I treated over 100,000 people. And I had severe problems with my hands. I was a young guy and I literally couldn't lift my daughters up when they were little because of how bad my hands hurt. And what I did is I just put the injection, I had them just put it in here, not even close specifically to a specific joint. And I just wanted to see if it would go where it needed to go. And it did. Literally within a few weeks, all of a sudden I could move my hands without pain. I could pick up my girls. So what we do, we find out where the issue is and we get as close to that area as possible to give those
Yeah.
cells the biggest opportunity to get where they need to go.
Yeah, I love it. I love it. I love it. Okay, a couple more. Okay, so Claretta asked a great question. Is there a different fee per each area we inject them in? And you addressed it a little bit. Can you clarify just how that works and why there's a savings when you do multiple injections?
Yeah, definitely. There's different levels, right? So our medical team has put together the protocols based on a few different things. So someone that's 150 pounds is going to need less in their knee than someone that's 250 or 300 pounds, or they may need a little bit more in their knee. And again, that the medical team determines all of that. We can give you an idea based on your weight and that type of thing. Will a knee get more than a shoulder? Absolutely. And even more if there's a little bit more weight, then we have to account for those things. So it will vary by joint and it will vary by your specific condition and your specific health as well. And yeah, to the savings, like I was saying earlier, the more you do when the nurse is there, the less it is because it eliminates a cost of them having to come out again. So we just pass that on to the patients.
And then Ms. McGlynn just asked if someone has spinal stenosis, but also has hip, shoulder issues, and overall body pain, would an IV address all issues or versus injections? And I think you just answered that. Am I accurate in saying that, like, when you have that many things going on, it will help the overall body pain, but if they want specific hip and specific shoulder targets, you would need more than one injection on that. Is that a fair
Yeah,
generalization or?
especially with joints, you're going to get the best result. Typically, what we've seen is when we put it right in the joint. And especially if someone's got, let's say they've got a bunch of inflammation in their body that we don't know about, or just they have fibromyalgia or they have pain all over, but they really want their knee to be better. Your body might, again, it's going to take the cells and do what it does with them. Like we can't tell them where to go, and we put them in, it's going to find the biggest problem and go and start working on it.
And that's why if someone's chief concern is, say, my knee, that's why you go into that joint because you don't
Exactly.
want, because most of us are walking around with chronic inflammation or mild to moderate to just because of the foods we eat, the environment we're in, and aging naturally. And I think this is where you could address this too. Like most people don't realize a lot of numbers that you get from when you go to your medical doctor and you get your numbers, whether it's your blood pressure, your blood sugar numbers, and you go through the whole checklist. Out of control inflammation causes havoc on all of those things. And
Yeah.
so just by getting your inflammation under control, a lot of those other things as a byproduct, as a domino effect, get better. Is that a fair assessment or I can't make a
Yeah,
claim on
absolutely. If you think about, just for instance, a lot more research has come out recently about cholesterol. So cholesterol is a natural occurring thing in our body, right? Only about 10 to 15% of your cholesterol level will have anything to do with what you eat. Most of it has to do with now when I say that, I mean about fat content, sugar content, that kind of stuff. Now, if you eat a bunch of stuff that causes inflammation, the reason our body lays down cholesterol in our arteries is because it's responding to inflammation. That's actually how our body heals the damage from inflammation to our arteries. So if we can decrease the inflammation, then we decrease cholesterol. That has been proven in science. And so a lot of stuff that's happening in our body is due to inflammation. I'll tell you this, as all the patients I've treated, thousands of patients, I've seen all kinds of x-rays. And I'll look at someone's x-rays and it may look really good, but they're in an intense amount of pain, right? And then I look at another person that their back looks like it's wrecked, right? No disc space. It looks straight. They've lost their lordosis. And I look at that and they're telling me they don't have any pain. And it's, wait, this doesn't make, I'm supposed, if I have a disc bulge, I'm supposed to have pain. If I have no disc space, I'm supposed to have pain. Why don't these people have pain? And what I've come to learn and find out is that really pain is typically due more to inflammation and those types of issues in the body because I can have a bad back and it's bad some days and good some days. Why is that? It's not like the back is getting good and then going bad, then getting good, then going. It's not doing that. It's the differences in our body and inflammatory markers and all those types of things. And again, I believe myself, that's why we see such great results with this type of therapy, is because
Yeah.
we put it in there and it's dealing with stuff that we don't even know is going on in the body.
Yeah. Yeah. That's so great. It's so great. Okay, couple quick things. One is if you have not yet spoke to one of our coaches and team members, please book a call or email or text them so that they can help let you know how quickly we can get it out to you and what the financing might look like, or if you plan on paying cash. We should cover just briefly what doesn't cover stem cells. Do you mind going through that little talk about Medicare, Medicaid, and if it covers it or not?
Yeah, definitely. Yeah, yeah. No insurance covers any of these treatments. And I say this, I don't mean to talk negatively, but I would guess most people on this call have tried cortisone, have tried all the Orthovisc, Genvisc, Synvisc, all those things. You've tried physical therapy. All the things that insurance covers typically aren't the things that are going to heal this thing long term. If I say if insurance covers it, it probably covers it up. That's been my thought process and what I've seen for a long time. But unfortunately, that's just the way it is. And really, with today, with copays, with a lot of people's deductibles and things, it's not too far off. And if you look at the statistics, if people go and get back surgery, it's 60 people die a day from surgical site infections from getting surgery in the
Yeah.
hospitals. We've got 40% of people, or no, excuse me, 1 out of 5, it's 20% of people that have a back surgery are going to get another back surgery within 11 years. And that is straight out of the American
Wow.
Medical Journal. Okay. So we know that even if insurance covers it, it still can be dangerous. It still is something that is probably not going to fix to the level that regenerative medicine can do.
Yeah. Yeah. Awesome. And so we work with the third party financing if you need financing, correct?
Yes, yeah, we have a few different so that is one thing, like medical financing companies do finance patients for this, even though
That's
it's
right.
not covered by insurance, and people can use their HSA cards too and pay for it
Okay.
that way.
Yeah, so I would highly recommend get on a call with a team member so that we can walk you through all this and find the best path that works for you. There's no judgment. We're here to support you 1,000%. There's no question that's a bad question. A lot of times people like when it comes to things like this feel guilty because they've let something go for time. There's no judgment here. There's no guilt-free environment. We're here to support you 1,000,000%. And I think if all of us were perfect at everything, there wouldn't be no purpose for us. So, Dr. Scott, thanks so much for making time for us today to do this. I want to say one more thing for everybody. The reason to book your appointment now as quickly as possible is every day we get hundreds of people requested for leads. And so the way we schedule is we schedule in batches in certain locations. And Dr. Scott, you may want to address this more than me, but some people are like, oh, I'll put it off till next month. Putting it off just keeps it getting put off. And what we found is that the more people put things off, the less likely they are to take immediate action to improve the quality of their own lives. As far as scheduling and getting somebody out to them, do you have anything you want to say as far as why getting on the calendar is sooner rather than later is very important?
Yes, a lot of what we do is we move around where we are advertising. And the reason that we do that is we try to clump it into groups because the more people that our nurse practitioner in that area can treat on a specific day, again, we can pass on those savings and it can drop the cost. So we try to get it in groups that we do in the same area. So there's probably a lot of people on here from Florida because we've got a lot going in Florida right now. We do move it around. Again, that helps us pass those savings on to you guys to do that.
Amazing. Dr. Scott, it's always great to chat with you. And hey, everybody who came on, thank you so much. And if you're watching or recording this, we just really appreciate you. Reach out to one of our team members here that you've been speaking with. And if we didn't answer a question that you may have, go ahead and ask the question. The team will throw it back up to Dr. Scott and we'll get you the answer rather quickly. So have an amazing day and I hope to hear from you soon. Okay. Dr. Scott, have a great day.
Thanks, everybody.